Good day to everybody. My name is Mohammed Shaban, student ID S344644, and our topic is type 2 diabetes in the UK. Type 2 diabetes in the UK is a major health concern for the NHS. Type 2 diabetes is a condition when the human body cannot make the sufficient hormone called insulin, whereas the type 1 diabetes is caused by the immune system. And there's another type of the diabetes which is called gestational diabetes, which only occurs when the women are pregnant and their blood sugar level rises up with the pregnancy and is automatically disappear after the baby is born. The insulin is the most important thing in the human body, which converts the sugar into an energy. If the body is not making enough insulin and there is a resistance to this, then the food we eat, which has the sugar and sweeteners, that thing stays in our body, which raises the glucose level in the human body, and it becomes a type 2 diabetes. Diabetes is a major concern all over the world. There are millions of people living in the UK who are undiagnosed with this disease because it has no symptoms at all, and the person who has this is not aware that he or she has the diabetes type 2. So the learning objective of this presentation is what is the diabetes type 2 and what remedies are available to cure it. In this slide, we also show the statistics, evidences, causes, and analytical view, and the implication of the practice. So, to make it more understandable, type 2 diabetes, a healthy diet can make a big difference, and the lifestyle changes. If we eat healthy diet and make physical activities in our daily routine, this type 2 diabetes can be preventable. So at the end of this presentation today, our audience will be able to understand that what is the diabetes type 2 and how it occurs and what measures we can take it to make our life more healthier and free of diabetes type 2. Thank you very much. Have a good day.
Brother Kume, ID number S345064. Today, I'm going to talk about diabetes in UK. Diabetes is a lifelong health disorder that prevents food from being turned to energy, featuring high blood sugar, and endless fatigue. This has become a major problem, adding to the numerous health issues of UK citizens. In 2019, findings were made in Diabetes UK, position a statement about 7% of UK citizens live with undiagnosed with type 2 diabetes. About 1 million individuals have undiagnosed type 2 diabetes. 1/3 of individuals have microvascular complication. At that, at that time of his diagnosis of type 2 diabetes, coupled with less financial and cannot buy medication. Again, uncover for the disturbing of population suffering from diabetes, which accounted for about 40,000 cases, about 3,000 diagnoses all nearly year, translate to 7.5% of UK children diabetes being diagnosed yearly. In the health condition is not life-threatening, but also can lead to inflammation of human body parts, and that's amputation. It was estimated that diabetes can cause amputation in about 175 per week. Those amputations performed patients with severe conditions, normally affected in your toes on your feet. Good health is better routine to check up your doctors every week or every month. Health is vital to everyone in the UK. Thank you.
My name is Daniel Bada, student ID 345015. My group are discussing about diabetes, but due to the complex way of type 2 diabetes, as doing the critical analysis, I'll be taking London as the case study. Due to London is a diverse city, 40% of the London residents comes from the Asian, Black, and other minor ethnic group. It is there's a research that shows that as an Asian person, you are 6 times more having more chances to have type 2 diabetes than an average white British person. And for Black, African, and Caribbean background, you are 2 or 3 times more chances to have type 2 diabetes. This can be managed, but due to self-management and not taking the traditional and the cultural background into consideration, having where you live, poorer or wealthier area, can contribute to the way you can self-manage your type 2 diabetes. There's a body called Despond that try to advocate in self-management, but the social care side of it might not agree with this. Managing type 2 diabetes, you need an area that you can as well have a good exercise. Due to the ethnic background, most of them don't have the time to have an environment that encourage exercises when due, and to visit their GP is recommended to have up to 8 checks. And people from all this community mentioned, they don't have the time to even see a GP once in a year. Part of the self-management is to deal with phone apps to check your sugar level yourself. Due to these people that come from this Asian ethnic background, they are not so educated to be able to use all this app, or the cost of having the phone itself is a big barrier. Talking of type 2 diabetes, is highly common within this community, Asian, Black, and Caribbean, due to the type of food. People don't have access to cheap food in order to manage their diabetics, and all this contributes a lot. Looking at the social care of it, people doing the house visit, it is recommended by CQC that most of the people giving the service user should be able to know how to monitor sugar level of their service user. If all these things can be addressed, I think we will have a fewer, or type 2 diabetes can be managed properly. This is my take on type 2 diabetes, but there are lots of pressure on the hospital again. Looking at the Newham and Tower Hamlet, according to the NHS data 2023, the higher rate, and it has doubled up to now, compared to where they are borough, like Richmond, for example. They know how to manage their type 2 diabetes due to the area and where they live. Better community, better area that encourage exercises, a lot of education to teach everyone how to use the phone now in order to manage their type 2 diabetes. My colleague will take it up from here.
Hello, my name is Tomasz Krolikowski, student ID S345329. This slide focuses on impact of 2 diabetes on patient and family in the UK. Public Health England 2019 reports that 3 in 5 people, or 64% living with diabetes, experience emotional or mental health problems because of their condition. This shows that diabetes affects not only physical health, but also emotional well-being and the quality of life. People may need to manage medication, food choices, physical activities, appointments and regular health check. This daily responsibility can feel stressful, particularly when someone is also working, caring for their family or dealing with other pressures. They may also worry about long-term complications, including heart disease, kidney problems, sight loss or food problems. Family and carers can also be affected because they may need help with meals, medication, appointments, and emotional support. This can place pressure on family routines and relationship. Goff explains that type 2 diabetes in UK is shaped by biological, lifestyle, social, clinical and health system factors. Financial pressure, food access, language, cultural needs and family responsibilities may all affect diabetes management. Therefore, its impact reaches beyond physical health and it can influence the person's emotional, daily life and family. Type 2 diabetes is not management in one appointment. It requires regular checks, reviews and ongoing support. NICE states that adults with type 2 diabetes should receive 9 key care processes every 12 months. Those include health check, blood glucose, blood pressure, cholesterol, kidney function, fit, BMI and smoking status, as well as eye screening. Different professional supports people before complications become serious. GPs and nursery monitor health result, pharmacists support medicine review, and then podiatrists and eye screening services help identify early signs of complication. The Office on Health Improvement and this part is explained a national diabetes audit, collect information about care processes, treatment targets, and structured education. This helps to show whether people are receiving appropriate support and then whatever services are working effectively. Diabetes care also requires teamwork between GPs, pharmacists, dietitians, podiatrists, and community service. Without early support, complications may lead to hospital admission and additional social care needs. Therefore, service need prevention, early identification, regular review, and join-up care that can reduce complications and avoid unnecessary pressure on NHS and social care services. Thank you.
Hi, my name is Elizabeth Agubiade. My student ID number S343983. My course name is Health and Social Care. Module name, Study Skill for Health and Social Care. I'm doing this video presentation on type 2 diabetic conclusion and recommendation. Type 2 diabetic remain a major UK public health challenge. OHID 2025. It is largely preventable through lifestyle change and early intervention. NHS England 2026. Regular checks reduce complications such as blindness, kidney failure, and amputation. NHS England 2026. Effective care require education, medicine, lifestyle support, and patient engagement. NICE 2026. Reducing inequalities is essential for better outcome and NHS sustainability. NHS England 2026. Recommendation. Refer high-risk adults to NHS Diabetic Prevention Program. NHS England 2026. Provide structured diabetic education to improve self-management and HbA1c control. NHS England 2026. Ensure all patients receive the 9 annual NIC care process, OHID 2025. Use person-centered medicine review based on cardiovascular and kidney risk, NICE 2026. Expand cultural appropriate weight management and remission support, NHS England 2026. Thank you. Good afternoon. My name is Maria de Almeida Teixeira Carvalho. My student number is 336156. My topics about diabetes type 2 in UK, how to prevent and solution. People should check their diabetes risk. Visit your GP surgery to discuss about your risk factors, family story, or blood sugar test. Reduce sugar drinks. Eat a balanced plate. Building a plate. Choose fiber-rich food. Use more vegetables, more fruit. Use beans, lentil, whole food, and drink a lot of water. Cut down a red and the processed meal. Programs can encourage a healthy lifestyle at the service level healthcare provider available. If you work every day or just twice a week, 20 minutes or half an hour, it helps as well. Work in group, stay active, cooking in class, should improve in screen, increase referrals to prevent programs and ensure support available and connection for the others to have a lifestyle like the slow, like shown slide. Check your personal risk, swap sugar drinks, plan balanced meal, move after meal, protect your sleep, working group, health cooking support, cultural relevant education, peer support safety activity plays. That's health as well. Reduce stress, stop smoking, get enough sleep, like get routine to sleep, eat less takeaway. If health is okay. And thank you for listening to me.